Hi everyone, welcome to NEET PG POQ series. So we are going to discuss the questions asked in your NEET PG 2024 Shift 1. So I'm going to discuss all the questions and related important one-liners in 15 minutes. Yes, are you ready? Yes. The first question, so this was the question asked in the exam. During post-mortem examination of suspected case of asphyxial death. So as you know, asphyxia means pulselessness. It is a combination of hypoxia and hypercapnia. Forensic surgeon noted circumoral pale area. So there was a circumoral pale area around the mouth and the nose and crescentric nail mark. So around the face and with the contusion laceration of the lips. So contusion, laceration of the lips. So what would be the best answer? So the answer for this question is smothering. Smothering, correct answer. What do you mean by smothering? That is occlusion of external air passages. See, in throttling, that is manual strangulation. Manual strangulation like this. So you will see 6 penny bruise. So that's why A is not the answer. Ligature strangulation. In ligature strangulation, you will see transverse ligature mark, which is not given there. Hanging, you will see oblique ligature mark. So what is the best answer? Smothering. Reference K.S. and Reddy, 35th edition, page number 281. Yes. So look at this. So this is the classical case of smothering. So what you will see? So the contusion, laceration of the lip and also injuries over the oral mucosa and the tongue. So this is the classical case of smothering by using pillow. Next question. Which of the following is contraindicated in iron overdosage? Contraindicated. Iron overdosage. So the answer is ball. So British anti-levisite, it is contraindicated in two conditions. So one is your iron overdosage. The second one is your cadmium poison. And also it is contraindicated in peanut allergy. So answer is A. Rest all are given basically. So answer is A as per Reddy 35th edition, page number 393. And remember, this ball is given in many of the heavy metal poisoning. So it is oily solution basically. Yeah. So this is what dimercaprol, also known as ball. Okay. It is not given intravenously. It is given intramuscularly. It is given in arsenic poison. Drug of choice in arsenic poison is dimercaprol. It is also known as British anti-levisite. Then, rigor mortis, order of appearance. See, as you know, rigor mortis means stiffening of the muscle, shortening of the muscle and the joint basically. It is because of ATP depletion. So, you know, for muscle relaxation, we need ATP. When there is no ATP, there is no muscle relaxation. The muscles will be in the contracted state. What is the order of appearance? So, very simple it is. So, according to the Nisten law, it is from head to toe. So, answer is A. So, what is Nisten law? Can be asked in your upcoming exam. So, Nisten law, it starts with the heart. First left side of heart, then right side of the heart within 1 hour. Then eyelids 3 to 4 hours. Neck and lower jaw. Then comes is the face around, that is 4 to 5 hours. Chest 5 to 7 hours. Upper limb 7 to 9 hours. Then abdomen, then lower limb 9 to 11 hours. Then fingers and toes 11 to 12 hours. It disappears in the same way. And we have one more rule, that is known as rule of 12. So it takes 12 hours for appearance, 12 hours for maintenance, 12 hours for the disappearance. So that is known as rule of 12. Then we have something known as Shapiro rule, that is proximo-distal progression. So next. So court proceedings in recording evidence of victim of rape. The better word is alleged survivor of rape. It comes under 184 BNSS. Okay, so definitely it is in camera proceeding. Okay, in camera proceeding. So rest all are not there. So this is what given in standard textbook as well, and it is also mentioned in section 33 of POCSO Act and also 366(2) of BNSS. 366(2) of BNSS. Remember, 366 camera in the court. So that is related to in-camera trial, that is in the presence of the judge and accused, advocate and public prosecutor and the victim. Next comes his favorite question, Barberio test. So Florence test, Barberio test, and Brentalaman blue test, very commonly asked. Remember, all these are screening test. So in suspected case of sexual assault, so yellow needle shaped crystal. So whenever yellow, dirty fellow, your answer must be Barberio test. Florence test. Florence, you will see dark brown rhombic crystals. Dark brown rhombic crystal, Florence. Same dark brown rhombic crystals are seen in Teekman test, brown man, rhombic crystals. But in Florence test, so you will see large clusters of rhombic crystals. Teekman test, that is a test for what? Blood stain. Brown rhombic crystals again. Takayama, I remember Takayama, pink mama. So that is pink feathery crystals. So all these are commonly asked. I'll repeat again. Barberio, yellow needle. Florence, dark brown rhombic large cluster. Teekman, dark brown rhombic small clusters. Takayama, pink mama, pink feathery crystals. All are basically test in trace evidence. Teekman, Takayama, confirmatory. Barberio, Florence are basically screening test for seminal stain. Then next question, as usual guys, Datura poisoning. So Datura, thorn apple, very commonly asked. Patient had consumed some unknown fruit, Datura fruit. So it looks like apple fruit, apple, thorn apple. Complaints of dryness of mouth, I am unable to speak. Slurred vision, diplopia. So all this, whenever it's given decreased motility, delirium, dilated pupil, so all 90 manifestation. So that is your answer is Datura. So when Datura consists of what? Atropine, hyoscine, hyoscyamide. Treatment क्या होगी बताओ? So treatment is basically that is your physostigmine. So cocaine, so in cocaine, no tactile hallucination. So magnum symptom, commonly asked. What is the legal limit of alcohol? 30 milligram percentage for drink and drive. Cannabis, so you will see run amok. Run amok means it is an impulse disorder of killing people. Stab, killing people, shooting, killing people, run amok, cannabis, bang, ganja, charas. Done. Next. So this is what your apple. So this apple keeps you ready with the physostigmine. Physostigmine also has side effects of cardiovascular side effects. Fatal dosage 100 seeds. 110 100. 1 strychnine, 10 that is your castor seed, 100 datura. 110 100 century. Done. Next. Then the question do come from MTP Act, medical termination of pregnancy. Here question is up to how many weeks? So that is a pregnant woman who is victim of rape. So victim of rape came to MTP, came for MTP. MTP can be done up to dash weeks. So rape, incest, disability. So it can be done up to 24 weeks. 24 weeks. So for oral contraceptive failure, that is up to 20 weeks. So now up to 20 weeks, 1 RMP. After that, 2 RMP up to 24 weeks. After that, there will be medical board. Done it is. Then look at this. Very, very important concept. You must know. In case of failure of contraceptive method or device, OC failure, OC pill failure, then it is 20 weeks. So it's applicable to married, also unmarried female. Even live-in relationship also. Done. Up to 20 weeks, advice of 1 RMP. 1 doctor is enough. Done it is. 24 weeks, 2 RMP. Done. 24, after 24 weeks, then state level medical board. So this medical board consists of consists of gynecologist, pediatrician, radiologist, social worker, other members, not the police, not the advocate. So why advocate, why police? Okay. Then this is beyond 24 weeks. So only one indication, congenital malformation of the fetus, anencephaly. Okay. Then breach of woman privacy, punishable. You should maintain 100% confidentiality. 100% confidentiality. Okay. Very important. So anytime. So say example. So in emergency, any RMP, immediately he can do MTP when there is an indication of therapeutic emergency, that is when there is a imminent death, that is which is established in the mother, then you can do RMP. Any RMP at any place he can do AMTP, can be asked in your exam. Done it is. Next, look at this now. This question, yes, medical board. All are the members of medical board. Gynecologist, yes. Pediatrician, yes. Yes. Advocate, why advocate? Advocate, no. Advocate only in the divorce, not in the medical board. Done. Next. Pregnant mother having 4 female children came to radiologist for a USG scan. As for you, determination of sex of the fetus. They're asking whether male or female. Tell me the truth, doctor, like that. Then what is your approach? Remember, it's a non-bailable offense. Non-bailable offense. First, you inform police. So call police, inform the police. Police will come, they will arrest that person. As per which act? PCP and DT Act, Preconceptional, Prenatal, so Diagnostic Techniques Act. Done it is. So refuse to do USG, inform police, they will take care of everything. Do USG? No, don't do that. It is a punishable offense, non-bailable offense. So, yes. And check fetal anomalies and tell the sex of the baby. 100 pakka, but pakka, jail, and also cancellation of license of the doctor. So, don't do that. Do USG, check anomalies, don't tell the sex of the baby. No, don't do that. Why are you doing all these things? You just inform the police. So this is what given in PCP and DT. What is PCP and DT? Preconception, Prenatal Diagnostic Techniques Act 1994. 1994. According to this, service provider, service seeker, advertiser, equally punishable. You can see here, first offense, doctor basically, 3 years of imprisonment, cancellation of degree, 5 years. Second offense, imprisonment 5 years, cancellation of degree permanently, permanent death sentence. Okay, done. Next, again, every offense is cognizable. What do you mean by cognizable? They can arrest any person even without warrant. Non-bailable. So magistrate has a power to refuse the bail. Non-bailable. Non-compoundable means case cannot be withdrawn from the petitioner. Non-compoundable. So very strict act. MTP Act, very liberal act. Then question about male having desire to cross dress, wearing female dress and high heel and female dress in order to sexually aroused. This is abnormal sexual behavior. This is known as transvestism, also known as eonism. So done it is. What is fetichism? Inanimate objects, shoe, petticoat, sari, all this. So by looking at inanimate objects or some unusual things, like looking at the hand, looking at the feet, he gets the sexual arousal. That is what fetichism says. Proteurism. Proteurism is rubbing genitals against the female body part, punishable under various sections of BNS. Done. Exhibitionism, 3 types: mooning, streaking, and one more is there, that is exhibitionism, right? Mooning, streaking, and one more that is known as anarisma also. Okay, exhibitionism also punishable when it is done in the public place. Flashing is also component of exhibitionism. Next, it comes under obscene act and obscene song under the sections of BNS. Next question, 11th question and last question. A 18-year-old rape accused claims himself 16 years of age. So, 18, so less than 18, male or female, juvenile. Okay. So here accused claims himself 16 years of age. No, I'm not of 18 years of age. My age is less than 18, maybe 16 or 17. So anyway, in heinous crime, when it is committed by juvenile, so there will be punishment like more than 10 years of imprisonment, not the life imprisonment, not the death sentence. So anyway, for what is the best answer? For accurate examination of age of the person using fusion of ossification center fusion, following X-ray are used. So the best is wrist joint. Elbow, no. Ankle, no. Shoulder, skull, definitely. Skull, so definitely no. So hip and ankle. So best is wrist, because lower end of the radius, lower end of ulna fuses at the age of 18 years. So when it is fused, more than 18 years. Not fused, less than 18 years. Next. A child was born after the 8 months after the father death. Grandparents filed a case that baby might not their son's child, and DNA came positive. What you call the child as? Done, it is posthumous child. So the child born after the death of the father, posthumous child. So it is a legitimate child. Fabricated child, that means fictitious child. Okay. Then supposititious child, no, it is not the answer. Superfetation, again commonly asked, you can just go through. Next. So this is about the brief discussion of all the questions asked in your shift 1 of NEET PG 2024. Thank you. Wish you all the best.